All right, we're going to take a look at the target of the subclavian artery and the muscle structures around it so we can get in there a little deeper with our pressures. So let's take away the skin first, and we can start to see that the red, which is the arteries, is quite close to the surface. You got very thin membranes. Let's get rid of the connective tissue, the shiny material. You can see there's a space right there. This muscle here, the platysma muscle, is pretty thin and not a really difficult thing to get past. So let's hide that for a second. Okay, now we can start to see the structures inside the neck. Now the red area, you can see that it's between the sternocleidomastoid mastoid muscle here and the trapezius muscle, as stated in the video. Now, when we're going after these targets here, you'll see that that gap is readily accessible. There's a thin band of muscle right in through here, but it's not very large and very pliable, and you can get in behind that and just put pressure on it through it if you have to, but we can go right into this gap and secure this artery right in through here. Now, right up in through here is your subclavian. It flows right into what's called the axillary artery. Same structure. And you can start to see right here, you've got vascular tissue going up into the neck as well. So this is the hollow pocket that we were talking about in the demonstration film, and that's what we're going to try to seal off. Now, when you're doing this, let me get this a little clearer screen here, and get the pen out. Okay, you're going to apply the pressure this way first. Okay, you're going to push down into it, and then you're going to drag along it this way. So we're pulling blood out of the brain and down along that artery. And that's what's going to cause the person to pass out, because the blood supply going to the brain is limited. And let's go back in here. Let's get rid of the musculature. And we can start to see that this branch right in through here, you've got the arteries that are going up, and let's get in a little bit deeper. Let's get to this one. This is your common carotid artery, and again, that's attached into that whole structure. As you can see, it just goes right in there. Let's see if I can get you a better shot at this. Yep. Okay, so here you go. You've got the brachiocephalic trunk, which flows right into the subclavian. Now, this carotid sinus is where the blood, let's get a pen out here. Okay, so the blood's going to come out of the aortic arch, and it's going to flow up into the brain as well as into the arm. And for some reason, when you cut the blood supply to the subclavian artery, it takes blood from the carotid. So I'll draw that out a little smoother. When you take blood away from the carotid, or you stop it, or the subclavian, it takes more blood flow to supply that arm. Why that is, again, as I mentioned in the film, it's probably due to the fight or flight response as a last resort to push away the danger or subdue the prey. So that's the structures. Let me get rid of this pen here. Okay, that are in the neck. We'll bring back the musculature so we can start to see. We'll hide this platysma muscle. Again, very thin membrane. Let's look at that. You can see it's just like a sheet. So not very thick and very hard to tighten, especially down in that area. You can practice with it, but you still have the pocket behind that you can get into. And that pocket, you can't really see it as well in through here, but it's down in there, and you can reach right down. When you grab into your opponent or your practice partner, you'll see exactly what we mean with that. It's also covered by this thin connective coating, but again, when you feel it on a real human being or yourself, you'll feel that that pocket is there. And as Cody was mentioning, even though we tried to tighten his muscles around that area to prevent that pressure, that it was still open, and you could still get way in there. So again, that's your subclavian artery, and that's what caused this knockout.